This is our last segment with Dr. David Aronoff, an infectious disease doctor at Vanderbilt University Medical Center. I'm going to try to get through as many questions as possible, so ask your question quickly. He's going to answer as quickly as he can while still giving you a great answer. So first, let's go to Joe. Joe, you're up. Thank you for your patience. What's your question?
Do you have me, Joe?
Yes, I do have you, Joe. Go ahead.
Okay. When I was growing up in the 70s, like going through school in the 70s and everything, the teachers always taught us to wash our hands before we eat lunch, and even our parents taught us to, when we came in from outside, to wash our hands. And Doctor, I appreciate you being here, and I wonder where the medical field and the Department of Education has lacked in that, and where they have disappointed us so much that even parents don't teach their children to do that anymore, and teachers don't teach the children at schools to wash their hands before they eat lunch. So can we have the medical field maybe touch base with the Department of Education and somehow heal us from all that?
All right.
It seems like it's out of control. Thank you.
Thank you, Joe. And just so you know, Joe, at both of my kids' schools, they always wash their hands when they come in the classroom and before they go to lunch. So I don't know if this is a widespread thing or not. What do you hear, Doctor?
Well, first of all, it is so important to wash our hands before and after we eat. And also, that can be protective against foodborne illnesses and transmitting all sorts of infectious diseases. So I'm a champion for hand hygiene, and I think it will be hard to find any human on the planet after this pandemic that isn't thinking about hand washing.
Yeah. All right. Let's go to Ann on the line. Hi, Ann.
Yes.
Yes, ma'am. Go ahead.
Okay, yes. I was 14 when Vanderbilt diagnosed my arthritis, and 28 when I was diagnosed with my lupus. And so I've been on medication for a long time, and I am one of the ones that's on the hydro whatever, I can't say the word. And I'm also on prednisone and other medicine that in the past has altered test results. My question is there a chance that should I be tested for COVID-19 that the result would be altered? And in the future, would test results be altered because of the medication that I'm on if I'm tested for this as far as antibodies go?
Okay, and let's get that answer.
This could come back.
Sure.
And in the fall or in the spring, would my antibodies be different because of the medication?
Okay, and let me get that answer for you. What do you think, Doctor?
Well, patients who are taking the drug hydroxychloroquine may be protected from getting infected. In fact, studies are going on right now to see if that's the case. So I don't have a great answer for Ann yet about that. I do think that patients whose immune systems are altered because of medicines like prednisone or underlying medical conditions, their antibody responses may be different, and I think we're going to learn a lot about that in the future. I don't have a definite answer yet, but that's a great question.
All right, let's go to Ted here. Ted, you are on the line. Go ahead. Ted, are you with me? All right, I'm going to put Ted on hold. Ted, are you with me? Oh, I thought he was coming to the phone. Okay, we're going to jump over here to Janelle. Hi, Janelle. Janelle, are you with me?
I am.
All right, go ahead. Good. What's your question?
My question is, I'm in the nursing field, working in a cardiologist's office. The 14th of last month, I found out the 14th of last month, my friends that I clean house for, they came down with the coronavirus. It's been several weeks now. One of them has been in the ICU on a ventilator, and his wife has been he has been tested that it was coronavirus. His wife has still not got hers back yet, but he's coming off the respirator, and she is temperature free for 4 days, and I usually clean every 2 weeks. I haven't been back there since this all happened, but it's coming up the next Saturday that I'm supposed to go clean, and I'm wondering, is that enough days with her being over the temperature, and is it going to be safe for me to go over there, or should I wait?
Yeah. Okay. What do you think, Doctor?
Well, a lot to unpack there. We don't know some of the answers to your questions, but I think to the extent that you can wait as long as possible to be in that environment would be helpful for your own health. But if it's possible for the folks there and you to wear masks, that may also be helpful, and to engage in really good hand hygiene and really to physically separate as much as possible in the facility that you can. It may be something that you also want to talk to your own doctor about.
All right. Good luck to you, Janelle. That's a tough situation. Mary is on the line. We have about 2 more minutes left. Mary, go ahead.
Okay, quick question.
Sure.
Patients of Vanderbilt that have been with Vanderbilt for 20 or 30 years, I'm understanding are going to be steered to Centennial Hospital and the overflow going to Music City Center for any ICU beds and ventilators. What can we expect out of release of information to get our major medical problem list, medications, pertinent information to the hospital that will actually be treating us?
Okay, good information. This is, of course, looking ahead if things have to shift, if we have that surge of patients.
Yeah, I don't know the answer exactly to your question because it's a really complicated one. Right now, we're not at risk of running out of beds or intensive care unit beds. Things are doing pretty well right now, and I know there are arrangements around the city in different hospitals for how we would share capacity for any kind of surge. And I am working under the assumption that there would be very good transparency with sharing medical information if a patient who's normally at healthcare Center A has to be at Healthcare Center B to get care. We in the medical community would be very much open about sharing with healthcare providers. But to your specific question, I don't have a specific answer right now.
We have 30 seconds left to pick your brain, doctor. So I would just ask for some parting words to all of us right now as we continue to walk through this pandemic.
Well, these are unprecedented times, and we are in the thick of a pandemic. And I think that the folks in Tennessee are doing a fantastic job of helping flatten the curve, slowing the spread of this virus. And that's meaning a lot for making it possible to care for the people who are sick, making it possible to protect healthcare workers, and reduce the degree of illness and death in Tennessee. So keep doing what you're doing. That's the main message. Keep hunkering down and participating in social distancing.
Dr. Aronoff, we so appreciate your time tonight. Thank you.
Absolutely my pleasure. Thank you very much for having me on.
You bet. We'll be right back.